Hello everyone, you're welcome back to our discussion class. So we are still on the biostatistics course discussion, and today we're going to be discussing on the topic clinical trial, epidemiology, and study designs. Okay, so we're going to be looking at what they mean and other details that is being involved. So before we actually go into the discussion, the major aim of this our discussion class is to help students understand the public health courses, okay, pass the exams, and most importantly, stay motivated throughout this academic journey because I notice a lot of people are feeling overwhelmed. A lot of people don't know where to start and they see all these courses like is one big deal or is challenging. Okay, so it doesn't have to be that way. These are very interesting courses that you should find so um interesting to know more about and to read about. Okay, so that's just the major aim of the this discussion class. So at any point you could not hear me, please let me know. Let me know, just draw my attention so I'll get to resolve the issue on time. We can have network glitches and a whole lot of that. So, when it comes to clinical trial, let's know what is clinical trial. Clinical trial is an experiment that involves testing medical treatment on human subjects. So, it maybe to find efficacy and the safety of a new therapeutic or diagnostic regimen. Okay, so the distinction of a clinical trial from other types of medical studies is the experimental nature of the trial and again its occurrence in humans. So whenever you hear of clinical trial, you just think of, okay, maybe there's a new vaccine that has been produced and you want to test it on a certain people before it's being approved to use by the whole population or by a targeted population. Okay, so it's an experiment that involves medical treatment on basically on human, most importantly on human subjects. Okay, so clinical trial is also a prospective study that compares the effect and value of interventions against a control in human beings. So the major aim is to check the outcome or the effect of a particular, let's say, therapy or regimen on humans. Okay. So a clinical trial must employ one or more intervention techniques. Yes, there must be an intervention for it to be called a clinical trial. So this may be single or combination of diagnostic, preventive or therapeutic drugs, biologics, devices, regimens, or educational approaches. So there are different intervention techniques that can be involved in clinical trial. Okay, so that's what clinical trial is. Just know that there are those experiments that involve human subjects. Um, the most notable example I'm going to give you to understand this is when COVID-19 vaccine was produced, they conducted clinical trial before they start dispensing all these vaccines to different countries. Okay, so clinical trial helps to know, oh, is this active? Can it treat this particular disease that we want it to treat? Or does it have any side effects on these people that we want it to use? So that's the major aim of clinical trial. Okay, so let's look at what is epidemiology. Epidemiology is the study of diseases in populations of humans or other animals, specifically how, when, and where they occur. So, what epidemiology does is that they determine what factors are associated with diseases, which are called the risk factors, and what factors may protect people or animals against disease, which are called the protective factors. So, epidemiological studies measure the risk of this illness or death in an exposed population compared to the risk in an identical or unexposed population. Okay, so we are going to be comparing clinical trial versus epidemiology to check the difference and then the other distinguishing factors between them. So clinical trial are mostly experimental. There must be an intervention. When you want to conduct a clinical trial, there must be an intervention. Like I explained, when it comes to vaccine, you can give drug, vaccine, or treatment. Then you observe the outcome. Okay, example, testing a new vaccine to see if it prevents infection compared to a placebo is an experimental research or study, okay, which is a clinical trial. But when it comes to epidemiology are mostly observational studies where the researcher merely observes and analyzes existing conditions or exposures. Okay, there are different types of epidemiological study, which are cohort, case control, and cross-sectional. We're going to be studying them in details as we go on. For example, studying the relationship between mosquito exposure and malaria infection in a community is an observational study. You're not like carrying out an intervention. You are merely going to observe, okay, these people that have been exposed to mosquito, would they really really be affected by malaria in subsequent time? Maybe given like 3 months, 6 months, 1 year, 2 years. Okay, so that's epidemiology. They are mostly observational studies, unlike clinical trial that experimental. You must intervene. Something must be done before you observe the outcome. Okay, so from our study material, I say the epidemiological studies are conducted using human populations to evaluate whether there is a correlation or causal relationship between exposure to a substance and adverse health effects. These studies differ from clinical investigation in that individual have already been administered a drug during medical treatment or has been exposed to it in the workplace or in the environment. Just like what I explained, in epidemiological studies, there is no intervention. It's either the people or the study population has been exposed to that particular thing you want to study about. For example, I gave my mosquito now. So they have been exposed to mosquito. I want to observe these people that have been exposed to mosquito for a long time or they are in endemic area of where there's mosquito. Okay, so we want to observe them over a time. Okay, would they come? How many people come down with malaria? So this malaria exposure actually causes does this mosquito exposure actually causes malaria in subsequent time? So epidemiological studies are majorly observational studies. There is no intervention. Why in clinical there are intervention? So let's move on to the three most common measures of epidemiological data. So during epidemiological studies, we mentioned that, okay, you collect data, you study disease exposures or outcomes, okay? So after you collect data about disease exposure or outcomes, there are statistical tools that you use to know whether the observed differences are real, whether they're important, whether they just occur by chance, or whether there is an increased risk, or maybe there's no difference in between exposed and non-exposed. Do you get? So these statistical differences are what we are going to be discussing. There are three major ones. We have number one, odds ratio. Odds ratio. So odds ratio are majorly used in case control studies. All right. They compare the odds of exposure among cases. We're talking of disease to the odds of exposure among controls that is non-diseased. Okay, let's say for instance, you want to check the odd ratio among people like smokers and then non-smokers. Okay, that is the odd ratio of them maybe coming down with lung cancer after a specific period of time. Those people that already have that are smoking for a long time, and then maybe those people that have not been exposed to smoking. Okay, so in case control, I'm going to be explaining what case control studies means in as we go on. All right. So there's a formula for finding an odd ratio. Odd ratio is equals to odds of exposure among cases all over odds of exposure among controls. So these cases are already the ones that have the disease of interest that you want to study on. Then all the controls are those ones that doesn't have the disease already, but you just want to use it to measure, okay, these people have the disease, these people don't have the disease, all right? So the odd ratio is actually help you to identify, or it help you to find out, okay, the odds of exposure among cases and then versus the odds of exposure among controls. And then for interpretation, when you calculate your odds ratio, okay, when you notice that the odds ratio is equal to 1, that means there's no difference in odds. That means there's no association between exposure between that particular disease and then exposure to a particular factor. And then when the odds ratio is greater than 1, that means exposure to that particular factor increases the disease risk. But if odds ratio is less than 1, that means exposure may be protective. Okay. So let's say, for instance, we calculated an odds ratio and is equals to 2, which means that the exposed groups has twice the risk as the non-exposed group. I hope you understand this. Okay. So let's go back to the second measure of epidemiological data. We have the standard mortality ratio. Standard mortality ratio. It is majorly used in cohort or occupational studies for comparing observed versus expected death. First of all, whenever you hear of mortality, you're talking of death. Okay, so when you want to calculate the standard mortality ratio, you are trying to compare observed death among a particular study group, okay, called cohort, can be a cohort. For example, patients with disease with a number of deaths that will be expected if that group had the same age or other factor, okay. Specific mortality rate as a standard or reference population. So what this is talking about is that the standard mortality ratio compares the number of deaths among a particular group of people all over the expected death in a population, in a reference or standard population. All right. So it also has a formula on its own. Observed deaths all over expected deaths times 100, as if you're taking it, making it in a percentage. Okay, so this is interpretation below. If the SMR, which is the standard mortality rate, is equal to 100, it means that the risk of death is equal to that of the general population. Do you understand? But if the standard mortality ratio among those study group is higher than 100, that means there is higher mortality than expected. Let's say you are studying a group of people that has diabetes, okay? You're studying them against the total population or um against a standard population. So if you find out that, okay, the standard mortality ratio of people that have diabetes is greater than 100, that means there is a higher mortality than expected. That means they are dying more from that particular disease than expected of them. Do you get? So, and if the standard mortality ratio is less than 100, that means there's a lower mortality than expected. Let's say, for instance, if we conducted a study and the SMR is equal to 150, that means there's a 50% higher risk of death compared, compared to the general population. Okay, so we say that the standard when the risk of death is equal to 100, that means it's equal to that of the general population. So when you're talking of 50, there's an increase by 50. That's a 50% higher risk of death compared to the general population. Okay, so let's look at the third um, epidemiological measure of epidemiological data. We have the relative risk. Relative risk is majorly used in cohort studies or clinical trials. We have to explain what clinical trials is. Then for cohort study, I'm going to be explaining it as we go on. So it compares the probability, that's the risk of developing a disease among the exposed group. So that will be unexposed group among the exposed group, so that of the unexposed group. So it also has the formula that the relative risk is equal to incidence among exposed all over incidence among unexposed. So this is also the interpretation. When the relative risk is equal to 1, that means there's no association of the disease between the exposed there's no association between the exposure to that particular disease and then maybe then getting exposed to that disease. All right, then when the relative risk is greater than 1, it means that exposure to that particular factor or to that particular thing increases the disease risk. But when the relative risk of developing that particular disease is less than 1, it means exposure decreases disease risks, or it can also be a protective factor. Okay, so just like when we relative risk is of 175, it means that 1.75 indicate that the exposed group have 75% higher risk of developing the disease than the unexposed group. Do you understand? So these are the three measures of epidemiological data, just like whenever you carrying out a study, okay, maybe a cohort study, case control study, or any research study, you getting to actually calculate all these risks, maybe the relative risk, standard mortality ratio, and the odd ratio will actually help you to make an inference or to make a decision about that particular group or that particular study. So you know where to venture the intervention on. Okay. So that is it about the three most common. So we have bias errors in epidemiological studies. What is bias? Bias is any systemic error in the design, error in the design, error in the conduct, or error in the analysis stage of a study that often results in a wrong estimate of the association between the exposure and the disease. So it's just like when you hear of bias, that something is biased, it means that something is wrong somewhere. When it comes to research, it can be in the design of the research. It can be in conduct of the research, can be in analysis of the results. That's where the error or the bias comes in. So that basically three types of bias error. So we have the selection bias. The selection bias occurs when the study group is not representative of the population from which it came. So just like when you're selecting your samples, okay? So when they are not representing the population from which it came from, or when they are not really being selected very well, okay, there could be a selection bias. All right. So we're going to be discussing different ways we can select sample, okay? So we'll also I will let you know the ones you can use in reduction of this selection bias. Then we have another type of bias, which is called information bias. So information bias occurs when study subjects are misclassified as to disease or exposure status. So we have the example of interviewer bias, we have recall bias, misclassification. For example, when maybe you are carrying out a study that is being based on information you get from people, and then these people you are asking information, maybe they have forgotten about that particular thing, so there could be a recall bias. Then we have the third type of bias, which is called the confounding factors. So confounding factors occurs when a third variable called confounder is associated with exposure. Okay, is associated with both the exposure and the outcome, but is not part of the causal pathway. So it's also this confounder always give a false impression that exposure causes the outcome. For example, studying the link between coffee drinking and heart disease. You know, a lot of times say if you drink coffee too much, it always causes heart disease. But age could be a confounder in the sense that older people drink more coffee and are more prone to heart disease. Do you understand? So confounder are those variables and those intermediate variable that is always associated with exposure and outcome. And if you don't take them into consideration, it could be a bias because when you are studying about, let's say, coffee drinking and heart disease, and you don't consider age, because the older someone gets, the higher probability they will have a heart disease, and older people drink more coffee, like okay? So these are confounding factors that can also cause bias errors in an epidemiological study. So when we are asked the three types of bias error, we have the selection, we have the information, we have the confounding factors. So on our next discussion, we're going to be looking at the study designs. Study design. So At this point, please, if you are watching to this point, please don't forget to subscribe to the channel. If you're watching this on YouTube, subscribe to it. You can share this our discussion to as many people as we know that actually need this, because I notice a lot of people are sending me message complaining that they don't even know where to start, an exam is starting and all those. So please send it to, maybe if you're among any group, if you're among your friends. Please don't be selfish. You can share to people. Just share to them. Let them also get to understand if this will be a better format for them to learn. The major aim is for everybody to pass this course and also to learn, not only to pass exam, but also to learn. Okay, please just subscribe to the channel and also share it to your groups and to all your friends that you know that will need this. So let's move over to study designs. What are study design? A study design is the overall plan or structure used by researchers to collect, measure, and analyze data in order to answer a specific research question. So it's just like the strategy is a strategy of research study, the strategy you use in carrying out your research as a researcher, okay? Maybe from the data collection to the data classification to measurement of data and then analysis. That is the study design. So successful studies need to address two important dimensions. Number one is the reliability of your research, and then the validity. Okay, so a reliable study should be replicable, should provide similar results if the same study parameters are applied. For example, if a research is being carried out outside of Nigeria and you want to replicate that particular research here in Nigeria, a reliable study shows that it should provide is replicable or similar results if the same parameters are being used here. Okay, so what is a valid study result? To check the validity is concerned with the ability of the study to correctly answer the question is asked. So if they say if something is valid, is how to show if that particular thing is talking or is actually saying or is actually correct on what the question it asks. Okay, so that's validity and then reliability of a research. So what is the importance of study design? Number one, it helps to determine how participants are selected, how data are collected, and then how comparisons are made. So these are the things you have to put in your study design structure. Okay, so let's take categories of study design. All study design fall into two broad classes. We have the observational studies and then the experimental or interventional studies. So observational studies, here the researcher only observe what happens naturally. There is no intervention. So that's the major difference between observational and experimental studies. Observational, there is no intervention, while experimental is also an interventional study. So there must be an active intervention. So in the observational study, the researcher merely observes the subject without controlling any variable. And this type of study are mainly used in social sciences, anthropology, and a whole lot of them, okay? They are used to comprehend human behavior. They can be conducted in natural sciences as well in order to comprehend behavioral patterns. And then just like I've explained, experimental studies, or they are called or interventional studies, the researcher actively intervenes. For example, they give treatment or vaccine, or they give health education. It's also an interventional study and observes the outcome. So it is a study where the researcher has control over most of the variables. So he conducts the study in a specific setting, such as laboratory, where he can control the variables. So just what is explained as that most of the experimental studies are being conducted in lab or in a specific setting so that the researcher can have control over most of the variables. It doesn't mean that all the variables can be controlled, but most of the um, variables has to be controlled. Okay. So let's look at the basic differences between experimental and observational studies. I've noticed this question, they asked it over and over again, year in, year out in different semester. So from what I explained here, I think you already know the major differences between observational and experimental. If I tell you to list out like 3 or 4 differences from what I've explained, can you do that? You can just pause this video to check if you can list the differences. Then you are good to go. So first of all, we say that experimental study is a study where the researcher has control over most of the variable. Okay, the researcher has control over most of the variable, while in observational study is a study where the researcher merely observe the subject without controlling any variable. Do you see the difference? I hope my network is not stopped here. Sorry, just 1 minute. Let me check. Hope my network is not stopped here at this point in time. I don't know why it's not moving. I just hope so. Okay. Okay. So the second difference, even though you cannot hear me, I hope you can just see the slide and read through. The second difference between experimental and observational study is that the researcher has control over the variables in experimental studies, so he can manipulate variables in order to make changes in environments. But in observational studies, the researcher does not control the research environment, so he mainly observes. All right. Uh, okay. Okay, that's fine. Then the third difference is that experimental studies are mostly conducted in natural sciences, while observation are mostly conducted in social sciences. Then for experimental also, the laboratory setting is mostly suitable since variables can easily be controlled, while in natural setting is being used in observational studies where the research subject can naturally just be observed without being controlled. Do you understand? Okay, so let's move on. So we say that 2 major classes of study design. We have the observational, we have the experimental, right? So let's take a look at experimental study design and then the different classifications. So when it comes to experimental studies, they have 2 different classifications. We have the uncontrolled trials, we have the controlled trials. Like we said, experimental, they are the one that involves active interventions. So among these interventions, they are the one that are controlled and the one that are not controlled. The one that are controlled, they are those ones with a control group for comparison. It just means that okay, when you are carrying out a controlled experiment or a controlled trial, it means that you have the people. Okay, you have the intervention or experimental group, and you also have the control group. So you can compare, okay, what is happening to these people and what is happening to the control group. Is it the same thing, or is there really a like an effect due to the intervention you are giving to the experimental group? I'm going to explain in more details using an example. But in uncontrolled group, just like the name, there are trials without a control group for comparison. This one, you don't even need a comparison. You just one group, one particular group, that is the experimental group or the intervention group that you are dealing with. Okay. So, and also under control group, we have 2 types. We have the non-randomized and then the randomized control groups. The randomized control groups here, the participants in that experiment are randomly allocated to maybe different group. Like I said, there are 2 groups in control trial. We have the experimental group and we have the control group. So when it comes to randomized, the participants are randomly classified, or they are randomly allocated to the control or the intervention group. But in non-randomized, subjects allocated to an intervention group without like not randomly. They're just maybe they're selected. Let me just put it as selected. Okay, these people go to this side, these people go to the control group, these people go to the experimental group. I hope you understand. So let's take, for instance, a researcher wants to test a new malaria vaccine. Okay, So that is for the control trial. For the want to test for this new malaria vaccine, you have to have two groups, okay, which are the experimental group. Let's say there are 100 people to receive the new vaccine, and then the control group, that is 100 people to receive a placebo. It's something called a placebo. Placebo is a non-active ingredient that is non-therapeutic, but it's just as if you are receiving the vaccine. It's not like no active vaccine. Though this control group receive a placebo, while the experimental group actually receive the new vaccine. So both groups, both the experimental group and control group, are followed for like some time, let's say 6 months, to see how many people will develop malaria. Okay. So this control group is just like helping you to observe if the vaccine or if the intervention you are giving, is it working or is it not working, or it's just the same thing with when people are not exposed to this vaccine. Do you get? Okay, so let's talk of uncontrolled trials example now. The researcher wants to test if a new health education program improves knowledge about family planning among women in a rural setting. Let's say, for instance, you want to teach about family planning, maybe among women of reproductive age in an IDP camp. So if when you're carrying out an uncontrolled trial, you don't even need a control group, maybe another group that you not teach. These people, we are just carrying it out using one group, that is just the experimental group. Okay, so how do you check results for uncontrolled trials? Or how do you check if your intervention is actually working? But when you can compare pre-test and post-test results, maybe before you teach, you carry out a test. After you teach, after you teach them about family planning, okay, carry out a post test to check if what you're actually teaching has been assimilated by them. I hope you understand everything about this experimental design. Okay, so let's move on to observational study design. When you come to observational study design, there are definitely two types. We have the descriptive study, then the analytical study. Descriptive study is the major aim is just to describe the just like the name, describe the occurrence and distribution of disease by person, place, and time. So there is no comparison group. And then it's the major aim or the major purpose is to identify patterns on trends in diseases, like in disease distribution, and it answers the question what, who, where, when. Like it just like is not an in-depth research about a particular disease. It just helps you to show the trend. Okay, for example, a study describing malaria cases in Abuja over 5 years. So just like a descriptive study, okay, this is what happened in 2020. They were like less prevalence of malaria. In 2024, there are more prevalence of malaria. So just like a descriptive, you're describing something, okay? So, but in analytical study, here there's a more in-depth research. There's a more in-depth study. Okay, it has to test hypotheses between associations, between exposures and outcomes. Okay, so there's a more in-depth research step to answer the question why did it happen? How did it happen? How is the exposure and outcome? Are they the same? What is happening between the exposure and the outcomes? Okay. It also helps to identify risk factors and then the causes. So that's it for analytical studies. Another analytical studies, we're going to be discussing of case control, cohort, or processional studies. Do you understand? So let's take a look at the more in-depth of analytical studies. So there are different types of analytical studies. We have the cross-sectional or cross-sectional analysis. We also have the transverse study or the prevalence study. Then the second type of analytical study, we have the case control study, and we also have the cohort study. Okay, so when it comes to cross-sectional study, it measures both exposure and outcome at one point in time. So the major definition of cross-sectional study is that it measures data at a single point, like at a snapshot. Okay, so unlike other type of study that maybe that involves an over time measurement of data or measuring at intervals, but cross-sectional studies is measures both exposure an outcome at one point in time. So it's a present study. Okay, it's look at the present study. Example of this is prevalence of hypertension among adults in Abuja, maybe in 2025. Okay, so if you're carrying out a research on this, you're going to just collect data from um from adults population in your study group at that particular time point in time. Okay, so you're just going to maybe distribute questionnaire and collect data, and you just know the prevalence of hypertension in 2025 at that point you're studying it. So it's not something you're going to continue forever a long time or over years study. That's for cross-sectional studies. Then for case control studies involve two groups of people. Number one is people that have the disease, which are called the cases, and then which are compared to those who does not have the disease, which are called the controls, to look for pyro exposure. Okay, so these case control studies can be also be known as retrospective study or case reference studies. So that means it looks back. Retrospective means something that occurs, like you have to check back on data. Okay, retrospective and prospective. Retrospective looks back, okay, while prospective looks forward. Okay, so retrospective is just like you trying to check, okay, what occurred previously. All right. So, for example, comparing smoking history of lung cancer patients versus non-cancer patients. Comparing smoking history of lung cancer patients, which are the people that are diseased, that is the cases, versus non-cancer patients, which are the controls. So you are studying a case control study here. Then when you come to cohort study cohort is just like a group of people. Okay, so following a group of exposed and unexposed people over a time to see who developed the disease. So it can be a prospective or it can also be a retrospective study. For example, following smokers and non-smokers for 10 years to observe lung cancer incidence. Do you understand? So case control study means having like the people who already have the disease and then people who doesn't have the disease. But in cohort study, it means following people up, okay, people that are exposed, for example, here, smokers, and then people that are not exposed to smoking, that is non-smokers. You follow them up to like 5 years to 10 years to check, oh, those people that are smoking, did they develop more lung cancer more than those people that doesn't smoke? So you can attribute that, okay, if you're smoking, you have the probability of developing lung cancer. I don't know if I'm making sense at this point, but in case control study, I just want to differentiate case control study and cohort study here. But in case control study, it's just like people already develop that disease, like lung cancer, all right? For example, comparing history of lung cancer patients versus non-cancer controls. Okay, people already have the lung cancer, which are the cases or the disease. Then you compare them with those who doesn't have the lung cancer. You check, okay, what causes this lung cancer in these people? Is it because did they smoke previously? So that's why it's a retrospective study. Did they smoke maybe in the last 10 years? How is the lifestyle like? Did they smoke very well, or did they not smoke? Like what actually resulted to this lung cancer? So that's the major difference between the case control and the cohort study. So we have another beautiful type of study, which is longitudinal study. So it's just like a wider range of study in which researchers follows same group of people over a period of time, making repeated observations or taking data or measurements at intervals. So what longitudinal study helps in understanding changes, trends, or cause-effect relationship over time. So that's the about longitudinal studies. Then the purpose of using the same individual or samples in the longitudinal studies is to observe any measurable change over time And this ensures that you can account for the same variables of interest in the duration of study. Okay, if you check from the definition, you see that longitudinal study have almost the same definition or the same explanation as cohort studies. But what I'm going to tell you is that all cohort studies are longitudinal, but not all longitudinal studies are cohort studies. We're going to be seeing the difference, okay? So example of longitudinal studies is a study conducted to understand the similarities or differences between identical twins who are brought up together versus identical twins who were not brought up together. Like I said, for this type of study, you follow the same group of people of target over a period of time, making repeated observation or measurement. In this particular study, now we are following identical twins. Maybe we have two sets of identical twins now. We have people living together, maybe brought up by the same parents or staying in the same house, and we have other identical twins. Maybe one is living in another state and the other is living in another state. Okay, we are trying to study them. Is there any differences between them? How is the environment change them? So this study observed several variables, but the constant is that the participants all have identical twins. So it makes use of the same individuals or the same samples. So researchers in this case will want to observe this participant from childhood to adulthood, okay, to understand how growing up in different environments influences the traits, influences the habits, and then the personality. Do you understand? So we have different types of longitudinal studies. We have the panel study. So in panel study, researchers repeatedly collect data from the same group of individuals at multiple time intervals. So this is to measure changes within individuals or groups over time. So the key feature of panel study is that same participants are followed over time. Then data are also collected at fixed intervals. It can be yearly, it can be quarterly, it can be monthly. So data are collected every time in panel study. So example of panel study is interviewing the same 100 family or 50 family every year for 10 years to study changes in their health behaviors. So imagine interviewing the same group of people for like 10 years to study changes in their health behaviors. If you're doing this kind of study, it's called panel study. So let's look at cohort study. Do you see why I say that all longitudinal studies are, all cohort study are longitudinal, but not all longitudinal studies are cohorts. So we have cohort study as a type of longitudinal study. So in cohort study, the study tracks a group of people called cohorts who share a common characteristics or experience. Example, people born in the same year, people exposed to a particular factor, for example, smoking, to determine the association between exposure and then the outcome, which is the risk factors and then disease occurrence. What are the key features or key characteristics of this cohort study? Is that number one, participants are group based on exposure, that is exposed versus unexposed, and is an observational type of study that researchers do not intervene. It can be prospective, that is looking forward, or retrospective, using past data. Example, following a group of smokers and non-smokers for 20 years to compare the incidence of lung cancer. Okay, so in cohort studies, in most of the cohort studies, you have to observe the group of people, the exposed and non-exposed, to check if there's disease occurrence, the rate of disease occurrence among any group of the study. So we also have what we call the retrospective study, which is the third type of longitudinal study. So just from the what I've explained before, retrospective, it means looking backward in time using existing data that's already been collected for other purposes to identify patterns or associations from historical data. Right, so the key factors of the retrospective study is that it uses existing records or data sets, so there's no need for new data collection. It's often less expensive and quicker than prospective study because this one there's already made data for you. then it relies on accuracy of previously recorded data. Yeah, this can have bias due to the error in data collection. Okay, so example is using hospital records from 2010 to 2020 to study the trend of malaria in a particular city. So these are the major three types of longitudinal study. We have the panel, the cohort, and then the retrospective study. So what I want you to note is that know the advantage and disadvantage of each study design as discussed in the material. As you can see, I not put the advantage, but I believe from the explanations I give, you're also going to be able to know the advantages and then the disadvantages, but you can still check it up and read up on them. Okay, so let's look at the exam and the TMA questions. Exam and TMA questions. So from what we've discussed in the past few minutes, so can you differentiate between clinical trial and epidemiological studies? Can you differentiate between experimental studies and observational studies? Can you differentiate between panel study and retrospective study? Between case control studies and cross-sectional studies? Between cohort study and clinical trial? So what are the basic differences between experimental and observational studies? So this question is from a 2023 first semester examination. This is a typical examination. Basic differences between experimental and observational studies. If you're making this kind of difference, you should not list less than 3 or 4. At least list from 4 up, because you know it's 8 marks, maybe like 2 marks each for the ones you got. So you should not list anything less than 4 differences between experimental and observational studies. So another question from 2022 first semester exam is describe the 3 main types of barriers in epidemiological studies. Good. I just explained it. So why I always put this exam and TMA questions for you to pause. You can just start writing on your book what you've understood, and so you can check how many questions can you answer off heart. That's how you're able to assimilate. Okay, so you can, from what you have explained within this past few minutes, you'll be able to answer this question correctly. I believe if you listen attentively, you'll be able to answer these questions correctly. But if you're not able to, just do yourself a favor to go back and check and listen to the teaching or read through very well. Okay, so thank you so much for your attention, for listening, for being part of our discussion class today, and hopefully I'm going to see you in the next class. Please don't forget, please subscribe to the channel as you're watching to this extent. It means that this is so valuable to you, and why not? Why not give it a subscribe and a thumbs up, okay? And also share to your friends. It's very, very important. Share it to the people that you know that actually need it, to that group that you know that is offering this course. Share it to them so that they'll be able to know better. So in our next class, we're going to be discussing about sampling and common sampling methods. And definitely, I'm going to see you. We're going to be discussing together in the next class. Bye.